This week at Macy's, take an extra 20% off everything you need for holiday hosting with your coupon or Macy's card. That's on top of already great deals, like 60% off kids' dresses and dressy looks, 30 to 70% off gorgeous fine jewelry, and 40 to 50% off dining and entertaining essentials. Plus, Macy's Star Rewards members can earn rewards even faster during Star Money Bonus Days, going on now at Macy's. Savings off sale and clearance prices. Exclusions apply.
Hey guys, it's Allie. Welcome back to Infertile AF, the podcast. This is episode 216 called Chris Jackson. This podcast is sponsored by Receptiva DX. Receptiva DX is a powerful test that has helped thousands of women who have experienced recurrent pregnancy loss or IVF failure. The test helps detect inflammatory conditions of the uterus that might be preventing you from becoming pregnant or staying pregnant. The most common underlying condition of a positive Receptiva DX test is endometriosis, with or without symptoms. If you or someone you know has struggled with IVF, Receptiva DX may give you the answer and treatment protocols that you're looking for. Talk with your doctor about Receptiva DX because the journey is so worth it. Plus, guys, Infertile AF listeners are getting $75 off the Receptiva DX test. So all you have to do is go to receptivadx.com or download the app Receptiva DX, use code INFERTILEAF23, and you'll get $75 off. Thanks, Receptiva DX. Today's episode is presented by Belly. Belly offers modern prenatal vitamins optimized for fertility, prenatal, and post-pregnancy health. To learn more about how to optimize your fertility and pregnancy health, check out their vegan-friendly, dairy-free, non-GMO vitamins for both men and women at bellybaby.com. That's spelled BELIBABY.com. The best part, if you use code ALLIE15, you'll get 15% off your first month of either Belly Women or Belly Men. Again, that's code ALLIE15, ALI15, for 15% off. Thanks, Belly. Okay, guys, super interesting guest today. I am talking to Chris Jackson, who's the CEO and President of Cicero Diagnostics. He's been in diagnostic lab testing for over 30 years, focusing on healthcare sales and marketing, and he has launched more than 35 products during his career, with the majority in the field of women's health and reproductive medicine. Today, we're going to talk all about how Cicero Diagnostics is giving a voice to silent endometriosis, why this is so important right now, how the Receptiva DX test, which is for unexplained infertility, failed implantation, and recurrent pregnancy loss, how it works, and so much more. Chris is going to talk about some success stories from some of the women he's worked with over the years, and he's also going to share some very exciting new generation testing that's on the horizon. So he's always worked really hard to advance things in women's health and reproductive medicine. I love talking to him. And without further ado, this is Chris's fertility story. All right, Chris Jackson, I am so excited to talk to you today. We've done some things together before, but we've never really done an in-depth conversation about all the amazing things that you're doing in the world of women's health and reproductive medicine. So welcome to the show. Thank you for being here.
Great. Thanks for inviting me. Looking forward to this.
Of course. So let's start out with, what you're doing these days and how you got into, women's health and reproductive medicine in the first place.
Sure. I've been in the laboratory space for greater than 35 years, and the majority of that actually has been in women's health, from prenatal genetics. I ran a genetics clinic, complete with the lab, as well as the genetic counseling and all the ultrasounds and amniocentesis and everything. And from there, I've just always been fascinated by this area of medicine and reproductive health. I worked for some startups that ranged from a test for preterm labor called fetal fibronectin, and that was a very successful test to triage women that were coming in and just finding out if they're in labor or not, to launching all the way back in 1989, the first commercial cystic fibrosis test for families that had that inherited gene. So a lot of exciting things that have led me here, and I've just worked with some great people, and that's kind of what led me to starting this company.
Wow. So I read that you've launched more than 35 products during your career. And the two that you just mentioned, I mean, think about all the lives that you've touched and improved and changed. Like, that's pretty cool. Do you ever sit back and think about the impact that you had with your, the teams that you've worked with, of course?
Sure. Well, yeah, I can't take credit for it.
You're amazing, but it's not just you, we know.
Yeah. Anyone can tell you the work that you're doing, and you feel the same way about that. When you touch people's lives, there's the reward in there that there's no monetary thing about that. So, ranging from women that over in Hawaii that would get triaged to decide or not whether or not they have to be flown by an air ambulance to get over to Honolulu to see if they're in preterm labor, to helping families prepare for a child with special needs, to now doing this in the fertility space. It's very rewarding and sometimes overwhelming when someone comes up and they're calling you crying because they're so happy that something that we were a part of helped them in their journey.
Absolutely. I feel that too, just people listening to the podcast, the write in and all that stuff. It's really humbling, but like you said, it's so cool to be able to do work that you're not only passionate about, but that you really do. There's other people on the other side, or there's real people on the other side of this. And that's really, really cool and makes it so special.
Yeah.
So tell me about launching Cicero Diagnostics. It was 2017, right?
Sure. So it actually was started back even earlier than that. I'd stayed in touch with some doctors that I'd worked with before, and they approached me about the research they had done with BCL6, this inflammatory marker that had an association with endometriosis as well as unexplained infertility. And so just taking a look at the research and everything, it looked like a great opportunity. My question to them, obviously, is there's enough markers out there in the world. How do we help the women with this? No one wants to find a marker and say, you've got this, if you don't have a treatment pathway, and that's where this all came to be.
Such a good question. That's why you're so good at what you do.
Well, there's so many things out there for people to look at and get thrown at and considered and everything. And yeah, at the end of the day, did we help people? Did this get people from point A to point B and provide answers that we didn't have before? And that's what intrigued me about this opportunity.
Yeah. So it's not just recognizing this BCL6 gene, but then what, right? What are you going to do? What are the action steps? So can you clarify? I know you and I have talked about this before, but for anybody who might be new to this world or new to what you do, what is BCL6?
So BCL6 is a marker of inflammation, and it's not just specific to endometriosis in the uterine lining. We have BCL6 floating around in our body in minute quantities at all times, but in certain conditions, BCL6, it's inflammation, and there's several inflammatory markers, but BCL6 is a marker that anyone who has experienced lymphoma knows that BCL6 is a marker of progression and how treatment is going and everything. So there's different uses of it. When this came to be, what happened with the patients that were suffering from unexplained infertility and recurrent pregnancy loss is that the scientists were looking for markers that were overly expressed in women that were having difficulties. And so they ran the gamut of markers. And BCL6 just stood out like a sore thumb that this is a marker that wouldn't normally be there on the uterine lining. So what's causing it? So then they go backwards and figure out that it's endometriosis somewhere else in the body. And this is the body's immune response and changing the hormonal pathway. And all of a sudden, BCL6 is this uninvited guest showing up at the worst possible time when you're trying to get pregnant. It's there on the uterine lining like a layer of film on a garden that you're just hoping for the seed to start coming up to the ground.
Such a good analogy. So what does it actually do when that layer of film is there? What is it preventing from happening?
Well, it's not allowing a couple things. Some women can get pregnant despite this. And so I want to back up and say that. So endometriosis, first of all, for your listeners, is uterine lining tissue that has somehow found its way outside of the uterus. And so these implants, usually it comes back through the ovaries, if you will, kind of backwards and can implant in the pelvic area or what have you. Well, these implants attach, and just like your endometrial lining, they're fed by estrogen once a month to build your lining up.
Mm-hmm.
And it also, because of the estrogen feeding it, it also generates this the BCL6 protein to be there, this inflammatory response. So it's showing up there. And what it's doing is it's interrupting this, like if we want to use that analogy again, this garden bed, creating this kind of unfair playing field, if you will. So, and a lot of times it'll block implantation from happening. And in other cases, it will dislodge something that's been implanted and not let it, the embryo get through that very challenging first trimester.
Mm-hmm. Okay. That really, really does explain it better probably than I've heard before. So thank you for that. So on your website for Cicero Diagnostics, on the homepage, it says that you're giving a voice to silent endometriosis, which is so important, especially now. Why do you think this is so important and the timing is so right for this right now?
Well, I think any of the fertility folks out there can tell you that endometriosis has always been known to cause issues with implantation failure as well as recurrent pregnancy loss. The issue really is that we stopped looking for it. And the reason we stopped looking for it is that 25 years ago, every workup for fertility through a fertility center included laparoscopy. Let's go look and make sure everything's in great condition. And they would find endometriosis more often than you would think. And a lot of these women didn't know they had endometriosis, hence the name silent endometriosis, or also known as asymptomatic endometriosis.
Mm-hmm.
And by that, it's, we kind of use the analogy, it's not your mama's endometriosis when you've heard of women that are just terrible pain as their period's approaching. I mean, we're talking about debilitating pain. We're talking about painful intercourse, painful bowel movements, heavy bleeding. All these things are hallmark signs of endometriosis. But in the fertility world, the majority of the women don't have any of those classic symptoms. And so it's silent endometriosis.
Mm-hmm.
It's endometriosis they didn't know they had. They didn't even know to consider it as a factor. And quite frankly, either have all of the newer doctors that are out there in reproductive medicine because they weren't really trained to be looking for it anymore, because laparoscopy is pretty much vanished except for folks with great insurance or people that are in terrible pain that have fought through the process to get it approved. So without scoping, it was there. It was always there. They really just stopped looking for it.
Okay. So the Receptiva DX test is best for unexplained infertility, failed implantation, and recurrent pregnancy loss. Is that correct?
That's correct. Yes.
Okay. So if somebody's going to take the test, what is it exactly? How does it work? Like, what should one expect when they go in and have this test done?
Sure. So now in the fertility space, working with fertility centers, they'll usually introduce the concept of the test after someone has experienced at least one failure, maybe after two failures, depending on if there's genetic testing of the embryos involved. Sometimes they'll use the test up front if the person has limited coverage, limited funds, and just kind of wants that whole kitchen sink approach, if you will. But by and large, in the fertility centers, it's usually introduced, at least to the patient, as a possibility for testing. So the test consists of an endometrial biopsy that they would collect at the time that they would normally do an IVF transfer, for example. And so that might be a controlled medicated cycle. The beauty of our test is it can also be done in a natural cycle, and a woman would just simply track her ovulation, and then 7 to 10 days after she knows she's ovulated, they would schedule the biopsy. And it doesn't have to be done in a hospital or anything like that. It can be done in a regular office visit. There is some intense pain for about 5 to 10 seconds as the biopsy is being taken. There might be some light cramping afterwards, but women after that usually resume their workday immediately, just without any heavy activities.
Okay, so they don't have to go under or anything like that to have this. Is it like an endometrial scratch kind of, or is that not the right term for it?
That was kind of the original term for scratching because, and there's a lot of debate on this, but a lot of doctors will still do it, but they'll go in there and kind of do this scratch, if you will, to generate an immune response to kind of, I don't say reboot the immune system, but to do that. So a lot of doctors don't believe in it, but in this case, it's a pipelle. So when you think of a biopsy, normally you think of something being cut out or what have you. This is actually through suction. It's they go in with the pipelle, go against the uterine wall, and then they pull back on the pipelle, which sucks some tissue away into this tube. So there is a bit of pain, but it's a little bit different than you think of a traditional biopsy where they might be cutting out something.
Gotcha. Okay. So normally before this was invented, basically, and correct me if I'm wrong, but I think one usually had to have surgery, right, to determine if they had endo. So this is really groundbreaking in terms of you don't need to have this invasive surgery that you had to have before. It's, the tissue can be obtained via the biopsy that you were just explaining. Is that right?
Yeah, that's a great question. And I also want to make sure that your listeners understand we don't use the word diagnose. We use the word detect.
Detect.
And
okay.
the reason for that is diagnosis needs to be, as close to 100% accurate as possible. And so the gold standard for that is laparoscopy. Now, having said that, depending on who's doing the laparoscopy, they may not even always see endometriosis. It may be lighter in color. It may not be these big implants or anything like that you see some of the traditional pictures of or what have you. But laparoscopy is still the gold standard. But again, it's just not used that much. So the whole purpose of this, the scientists that were involved are actually practicing clinicians. And they were looking for how can we do this for women that really don't want to go through invasive surgery. They're not going to volunteer to do that, especially don't want to pay for it out of pocket since their insurance isn't covering it. But how can we help them see if they're in that group that is suffering from their infertility or their pregnancy losses as a result of endometriosis that wasn't rearing its ugly head in any other form, any other symptoms?
Okay. So if it is detected that one has this BCL6 gene, we talked about this a little bit before, but what should they do next? How is it treated? Is it hormone suppression therapy, surgery, something else? What do you find is kind of the standard in terms of next steps?
Sure. So surgery has been the option for most women for forever, actually, since the whole field of reproductive medicine came to be. That just isn't a viable option for a lot of women. Now, having said that, and I'll talk about an alternative treatment that is being used extensively in the fertility space. But with laparoscopy, that's still a great option for women that are having these symptoms that maybe they never thought of endometriosis as the reason behind some of those symptoms I was telling you about, the painful bowel movements, painful intercourse, the heavy bleeding. Those are hallmark signs that if they didn't understand, surgery is the only way they can really treat those.
This week at Macy's, take an extra 20% off everything you need for holiday hosting with your coupon or Macy's card. That's on top of already great deals, like 60% off kids' dresses and dressy looks, 30 to 70% off gorgeous fine jewelry, and 40 to 50% off dining and entertaining essentials. Plus, Macy's Star Rewards members can earn rewards even faster during Star Money bonus days, going on now at Macy's. Savings off sale and clearance prices. Exclusions apply.
The other treatment option that's available for fertility patients is hormone suppression therapy. And so it's different from surgery, but it's been very effective in the fertility space in that you are given, they're called GnRH agonists, but it's a fancy way of saying we're shutting down your reproductive system for a couple of months. We're putting you in a menopausal state is probably the best way for most people to relate it. You're not cycling, you're not having your period, nothing's going on. So what it's doing in addition to that is that it's taking estrogen and progesterone out of the picture from doing their normal thing. And so the uterine lining is not building up, but also it's not inflaming the uterine lining by doing anything with those implants or the endometriosis and creating that immune response. So it's essentially just cooling off and letting everything just relax. And what we found in some of these outcome studies that we've done is that was long enough. And when I'd say long enough, the women did 2 30-day injections of the Depo-Lupron treatment. And then they went right into a frozen embryo transfer cycle. Didn't have a period. We don't want to introduce estrogen, but went right into frozen embryo transfer cycle. And now we're getting in our published report, we got about 59% live birth success rates. Now, the doctors that we're working with and the data that they're sharing us, they're getting 75 and higher on the success rates with the Depo-Lupron. So real exciting stuff, and a great alternative for someone who just, I didn't even know I had endometriosis. Now you want to do surgery on me. That's not an option. What else you got? So that's how this all came to be.
Yeah. So I saw on your website that in October 21, you guys had reached the 10,000 patient milestone. I'm sure you've far surpassed that by now. Do you have any idea how many patients you guys are at right now in terms of detecting this and helping them?
Sure. So we've done over 25,000 biopsies. I think it's probably closer to 27,000 now. The outcomes data that we have now, where we work with a lot of different name centers around the country, some of the CCRM facilities, and NYU in New York City. I think we've got about 32 now, but that are participating in this, and this is all blinded, but they provide us their outcomes and how they treated the patients. So now we've got outcome data on about 4,000 patients. So it's real exciting now, and it's the best evidence we can give other doctors who haven't started doing the test yet. Is just say, you don't have to look at us in our publications. You can talk to your peers out there that are using this test now, and they'll share with you the success rates they're having.
Right. So how do you line up with these fertility centers in the first place? I guess this is more of like a business question, and I'm just curious, like how many, you said you're working with somewhere over 30 right now. How many would you guys like to be working with ideally? Is it like every fertility center?
Well,
and
actually,
how do you,
we're working,
how are you getting in the door, I guess, is what I'm asking.
Sure. So we're actually working with over 325 fertility centers here in the U.S. We've got about, I think, 65 fertility centers around the globe that are using the test. Traditionally, we have a sales team that is out there talking with doctors and making sure that they're aware of the latest data.
Yeah.
But to tell you the truth, I would say that at least 40 to 50% of our offices that use us started out because of the women that read about us, heard about us on a podcast, are in groups, support groups for unexplained infertility, for recurrent pregnancy loss. The information out there is just powerful, and it's shared. And centers will call us up and say, we want to do this for a patient. We need someone to come in and tell us a little bit more about it. And you have to remember, doctors, it's very difficult. So we'll meet them at trade shows and educate them there. They'll attend conferences and hear seminars. But it's very tough for them to decipher through all of the litany of tests that people are out there throwing at them, and trying to figure out which ones are really going to benefit the patient. And so they don't look like someone who's out there, positioning something that maybe doesn't have the data behind it like our test does.
Absolutely. So just playing a little bit of devil's advocate, what do you say to people that are skeptical about this? Have you faced any kind of feedback that was just like, no, we're not going to do that, we don't believe in that? Or does the data speak for itself in this case?
Well, that's a great question. There's always skeptics with the internet. There's always going to be skeptics, even more so. But the majority of the doctors that we talk to have embraced this. The difficulty for them sometimes is to stop what they know, which is doing IVF. They're in this mode of, okay, that didn't work, let's try again. Okay, that didn't work, let's try again. And it's interesting because they believe in their heart of hearts, if you give them, 5 or 6 times at doing an IVF transfer, they're going to get everyone pregnant. Well, not everyone has either the embryos, the financial means, the patience, or the physical and emotional capability to go through that many experiences. Not to even forget the strain it puts on a marriage. And so when I reach skeptics that are saying, well, Chris, we need more data and all that, I can point them to over 25 studies. I can point them to some of that data that I was telling you about from their colleagues throughout the country. But more importantly, I just ask them, and patients should do this too, is what can we do now? What else can we do before I just spend another $10, $15, $20,000 and expect a different result from you? And that's where this comes in, where this is consumer medicine. And a lot of the women I talk to, they're afraid to talk with their doctor. And I said, your hands are on the steering wheel. This is an opportunity for you to stop the process, because they are in motion and they know what they do, which is IVF. But it's up to you to grab them and say, I'd like to consider other options before I just jump in and do a third cycle here, doctor. I'm sorry. I thought I was going to be pregnant by now. I really would like more information. I'd like to do this test. I'd like to do that, or what have you. And I just encourage women to do that, because the doctors will listen. You are paying for this, so they will do what you ask. But the important part is that you have to make sure they're ready to follow the treatment guidelines as well. Because if they're not willing to do that and just do the test for you, then that's a separate discussion, because there'd be nothing more frustrating than doing the test and the doctor not acting on the result. But the skeptics are getting fewer and fewer, and the data is out there. And I think it just comes down to having a great talk with your provider about where you're at right now in your journey and where you need to feel comfortable before you just let them continue to do what they're doing and scheduling another transfer.
Yeah, I love that notion of your hands are on the steering wheel. I think that's such an important thing. We talk about this in our fertility rally groups all the time, is like, you've got to advocate for yourself. And I think that for so long, women didn't know, and I didn't know when I was first in this world, going through it, that I could ask questions and ask for certain tests. And, thankfully, I didn't have to go through a years-long journey once I got into treatment, but so many people do. And, to give them that power and, empower them by giving them the information about things like this, I think is so important, because for so long it was just like, the doctor knows best, do what the doctor says. And now it's like, we've got a voice and we've got these hive minds that are sharing information that, you can go in with a list of things to ask about. And I think I've seen it myself. People have had success by something they learned in one of our groups, or by, listening to something or watching an Instagram live or something. So that's pretty cool.
Well, and another thing, Allison, what I talk with the doctors, and I tell my reps to engage with the doctors, is that at least make sure the patient has the knowledge that this is available and it's an option. You may not be selling it 100%. You're not making any money on it, all that. I get that. But I let the doctor know. I said, what you don't want is a scenario where they come in after 4 failures and now they found out about this in a chat group or something like that, and then come back to you and say, I'm leaving you. And the reason I'm doing that is you could have at least told me about this $30,000 ago or 2 transfers ago.
Totally. Yep.
And given me that option. And that's all I try and prepare the doctors. I don't tell them how to practice medicine. I let them know what other clinics are doing and what their success rates are. But there is some competition for patients. And I remind the doctors, after 2 failures, whatever confidence they had in you is dwindling. And you've got a husband that may not have been involved up front, but is now looking at this going, okay, now what are we looking at? Or a partner, the next step's a home equity line or what have you. I'm going to have a little bit more say in this and who we work with. So that's all I do to prepare the doctors.
So brilliant. So can you share a success story or two from, you mentioned that people will come up to you at trade shows, or you get letters, or, just talk to women or couples, or, who've gone through this and ended up with healthy pregnancies. Does anything come to mind that sticks with you?
Oh, gosh. There's so many testimonials on our website, and they're all real. And I'm trying to think of 1 or 2 specifically. I mean, the ones that catch me off guard are, I had a woman that was in the industry that worked for another company that had a genetic product, nothing to do with fertility necessarily, but came up and she was 7 months pregnant. And it was because of our test and the treatment. And it's just those that catch you off guard. But I think I alluded to it at the beginning. When we get phone calls, it's very, it's rewarding, but it's also just catches you off guard to hear somebody so happy that they got a positive result. I mean, who gets a positive test result and is happy about it?
Right.
And what it's about is that it doesn't necessarily guarantee they'll get pregnant, but for the women that we're helping, about 2/3 of them that were about to give up, we gave them a new pathway to pregnancy. And
Absolutely.
that was something that they didn't even want to, the word hope had kind of gone out the door. So
Yeah.
that's the rewarding part. But
Right.
I can tell you, if any of your listeners go and they see a testimonial on our website, I can put you in touch with that. I can put them in touch with that person so they know. But the
Yeah,
biggest
that's
thing
pretty
is that
cool.
they're just not alone. This journey has been done by so many women, and I know just from talking with them, it's one of the loneliest things you can experience. But there's so many groups out there and so many people that are willing to help that have been there, that all of a sudden you realize, wow, there's 2 million other people on this beach right now. I thought I was under my own umbrella. Just
Absolutely. I think, like you said, just having a plan or having some sort of answers when you've been fledgling for so long, especially when it's unexplained, just gives you that, hope, like you said, but also like a little bit of relief and like an action plan. And that feels really good because there's so much of this that you can't control, So when you get a modicum of control, you're like, okay, I'm going with that.
Let me say another thing too, is unexplained infertility is not a diagnosis. It's a label that's given by doctors when they have no more clues. And I just wanted, I challenge the women out there just to say, what does that mean?
Right.
Because to me, that means we need more information. What else can we do? And that's not a promo for our test or anything like that. It's just a fact out there that nobody wants to be labeled. Nobody wants to be told, maybe this isn't for you, that type of thing. So
Right.
it just means other options need to be explored.
Yeah. So, Chris, before we wrap, you've obviously got a lot on your plate with this, but is there any other new generation testing on the horizon for you guys, or any other areas that you want to explore in this women's health and fertility world?
Oh, gosh. Yeah. We have so much going on in the research area. A lot of it will be out in the next year or two. I think the biggest thing that we're looking at right now is a marker that should be out later this year. That is it looks like the key behind what we call progesterone resistance. And a BCL6 marker does identify that, but we think this marker is even better at doing that. And especially for women that are getting pregnant but can't stay pregnant, the ability to detect progesterone resistance is key, because progesterone is this important hormone that takes over for estrogen in developing the uterine lining and nourishing the embryo. But it also signals to the rest of the body, hey, we're pregnant. Do not have a period. Do not attack this foreign object. It's an embryo. And it's a very important role for progesterone. And you think about it, it's the main ingredient in birth control. You're taking it to trick your body into thinking you're pregnant. So if progesterone can't do its role, what happens? The lining breaks down and you have a period. If progesterone can't do its role, the embryo doesn't become nourished and Mother Nature will discard it. So this is kind of the process that we're looking at, is to really help women that maybe not even setting in a fertility center because they don't have the means, or IVF is not something they want to do. So our next step is to be able to offer some technologies that we're doing to women that may never set in the fertility center, that can access these tests through their OBGYN.
Wow.
And because we're doing it in a natural cycle, when we collect the biopsy, that'll be there for them. So that's what we're really excited. And those are the next steps for us.
That's so exciting. So we will definitely be keeping an eye on you guys and what you have coming out. And, I just want to say, I truly know that you want to help people, and that feels so good to, keep having these conversations and keep learning things. I always learn something when I talk to you, and hopefully everybody listening has learned a lot more too. But before we wrap, what would you say to somebody right now who's listening and might just be in the throes of the depths of despair and really, really struggling? You talk to these people all the time.
Well, I do, but I just encourage them. One of the great things about the internet, because we always talk about the negatives, but the positives are the accessibility through blogs, through Facebook pages. There's a community of women out there that are holding each other up. And just think of a woman before the internet, before these groups existed, that you're just lonely. And there's almost no excuse for it now because you can find a group for everything. But this is a really necessary group at the most challenging time in your life, because obviously some of the women I talk to, even the husband has just they want to be there for them, but they can't do anything for them. And so it becomes this empty kind of void. Well, there's women out there in support groups that are holding everybody up and not just recommending tests and everything, but just there for them. You know, what were your results? You're sharing your results, and there's 30 women that know exactly what you're going through versus people you work with who may not care. You may not want to share that information with, but these people are generally interested in helping you because you're helping them as well.
All right, guys, thank you so much for listening. And if you want to hear more about what Chris is doing and what they have going on, definitely go to receptivadx.com. You can also get $75 off the test if you use code InfertileAF23. So definitely check that out and look for more to come from Chris and his team. They're working so hard to make everything better for everybody who's on this journey. So thank you as always for listening. Thanks again to Chris for such a great convo, and I will talk to you guys next time.
This week at Macy's, take an extra 20% off everything you need for holiday hosting with your coupon or Macy's card. That's on top of already great deals, like 60% off kids' dresses and dressy looks, 30 to 70% off gorgeous fine jewelry, and 40 to 50% off dining and entertaining essentials. Plus, Macy's Star Rewards members can earn rewards even faster during Star Money Bonus Days, going on now at Macy's. Savings off sale and clearance prices, exclusions apply.